Okay. Thanks everyone for joining us. We'll just get started here with a land acknowledgement, and then I'll pass it over to Jamie for introductions. So we would like to begin by acknowledging here at the Center for Family Medicine Family Health Team, we reside on the ancestral and treaty lands of the Haudenosaunee, Anishinaabe, and Neutral people of the Haldimand Tract in Waterloo Region. Let us all take a few moments to acknowledge the history of the land we are situated on and the existence and struggles of the Indigenous peoples who have largely been absent from the Canadian consciousness for hundreds of years. We acknowledge that our ability to be working and living here now in our various territories across Canada are a direct benefit of policies of expulsion and assimilation of Indigenous peoples during the time of settlement, confederation, and since. The harms of these policies are many and are still being felt in Indigenous communities today. Let us all collectively reflect on our role in repairing our nation's relationship with the original inhabitants of Turtle Island, now known as Canada.
Great, thanks so much. And everybody can reflect on the areas in which they live in. Thanks everybody for joining us. We're really excited to have Lauren and Kiesha today, and a big thank you to them, and also Sarah, who is involved with working with them. So I'll just do a couple of housekeeping things initially. We usually format the webinars in that we'll save questions till the end, but certainly you can also post some questions into the chat that we can kind of moderate at the end as well. And we will also have a survey at the end of the webinar, just, quality to try to improve things. So if you can stick around at the end to sort of use that QR code that comes up to answer the survey, we'd greatly appreciate it. So without further ado, I will give you a short introduction on Lauren and Kiesha. So Lauren is a PhD candidate in the pharmaceutical sciences at the Leslie Dan Faculty of Pharmacy at University of Toronto. Her PhD work is focused on co-developing, revising, and evaluating a toolkit that aims to improve medication self-management among adults with spinal cord injury and dysfunction in Canada. Pardon me, sorry. Kiesha Mastrodimos is a 29-year-old, and Kiesha mentions that she's had a spinal cord injury herself, so she's tetraplegic after a car accident with a moose back in 2013. Kiesha is a published author, a psychology student, and a part-time employee at Costco, and mentions that she's living her life to the fullest with this injury. So we are, again, so grateful to have both of you with us today. A super important topic when we're talking about pharmacy and medications, and spinal cord injury certainly always comes up as a big topic within our group. So I will turn it over to you two.
Awesome. Thanks so much for the introductions. So as it was mentioned, but we'll be talking today about the co-design and evaluation of MedManageSCI, which is a medication self-management toolkit for adults with spinal cord injury or dysfunction. And while Kiesha and I have the privilege of sharing this program of work with you today, there are a lot of people who have contributed to it over the past 3 years. So we would just like to acknowledge the principal investigator, Sarah Gilsher, the co-investigators, staff with the OptiHex lab, specifically Rasha and Malia, the working group, which is comprised of individuals with spinal cord injury, caregivers, and healthcare providers from across Canada, as well as the various funders who have supported different stages of this work. So in terms of what we will cover today, we'll talk about the process for co-designing MedManageSCI. I'll go through a website orientation for you. I'll talk a little bit about the results of the evaluation, and then we'll talk about some lessons learned for engaging people with lived experience through the research process. And I'll hand it over to Kiesha to get started.
Perfect. And I'll preface that they're doing fire alarm testing at my building today. So if you hear any of that, I do apologize. So a spinal cord injury results from damage to the spinal cord. The injury may be traumatic, such as a fall or motor vehicle accident, or non-traumatic, which are often the result of infections or cancers. No matter the cause, the SCI can affect movement, sensation, and automatic body function. Some people, like myself, may lose some or all movement in their hands, arms, and legs. Others may lose feeling, like the ability to sense touch, pain, or temperature. It can also affect automatic functions such as control of the bladder and bowels, blood pressure, and other processes that the body normally handles on its own. Secondary complications may also develop, such as spasticity when the muscles become tight or stiff. Pain is also common and can be nerve-related or caused by other tissue damage. Another serious complication is autonomic dysreflexia, which can be life-threatening. It happens when something irritating or painful occurs below the level of injury, like a full bladder, tight clothing, or a skin problem. Because the brain cannot properly send signals past the injury, the body overreacts. This can cause a sudden rise in blood pressure, a severe headache, sweating or flush the skin, and increased muscle tightness. If the cause isn't found and treated quickly, it can lead to serious problems such as stroke, seizures, or even death. And then, perfect. When someone acquires an SCI, they are bombarded with information, resources, and prescribed multiple medications, all while also trying to come to terms with a completely new reality. After my injury, I was taking 15 to 20 medications a day, everything from vitamins and painkillers to laxatives and bladder medications. At the time, I didn't question any of it. I was just focused on getting through each day and learning to cope. It wasn't until I left the hospital that I finally had space to start researching, asking questions, and really understanding what I was taking and why. Over the years, with support from healthcare providers, family, friends, and others living with a spinal cord injury, I was able to cut my medications down to 5. Taking a lot of medications can be especially risky for people with SCI. Managing multiple secondary complications often means multiple prescriptions, which increases the chances of drug interactions, side effects, dosing mistakes, or even medications that make existing symptoms worse. There's also the risk of dependence or addiction, especially with opioids. When I was first injured, I was immediately given intravenous morphine in the ambulance and continued receiving it for 2 months. I realized I was becoming dependent as I found myself watching the clock and timing my day around when I would get the next dose. Eventually, I noticed I was becoming dependent. Even though my doctor suggested tapering off slowly, I chose to stop it right away. Because of the abrupt stop, I went through withdrawals. I was only 17 at the time. Because of that experience, I no longer take opioids for the fear I'll become dependent again. So taking multiple medications can also lead to more healthcare visits, medication-related issues like blood pressure changes or heart and breathing problems, which can mean more doctor's appointments, emergency room visits, and even hospital stays. Overall, managing a long list of medications can feel overwhelming. It's hard to know where to begin, which medications are really necessary, whether there are alternate treatments, and how to safely reduce or stop medications without causing new problems. Next one. Perfect. Managing medications comes with a lot of challenges, as I mentioned before. Dealing with side effects can be tough, especially when you're trying to figure out exactly which medication is actually causing the problem. It can also be complicated and time-consuming to keep track of when to take each medication, how to space them out properly, and how to fit them in your daily routine. With so many details to think about, it's easy to feel overwhelmed and unsure where to start and how to make changes safely. Self-advocacy is another big challenge. Many people don't know what questions to ask. They feel like their concerns aren't being heard, or run into healthcare providers who don't have much experience with spinal cord injuries, or who have limited alternative treatment options. In my own experience, this has been the hardest part. Since my injury, I've had many healthcare professionals question my knowledge, my experience, and research, and dismiss my concerns or recommended treatments because I wasn't comfortable with, or recommended treatments that I wasn't comfortable with based on their perspective and their expertise.
So I'm going to go into a little bit more now about what medication self-management actually is. So medication self-management includes different tasks, skills, and behaviors associated with an individual's ability to navigate different factors, including physical, social, and cognitive, that influence somebody's decisions to take or not take medications. These tasks might include having the knowledge and related confidence to deal with medical, emotional, and role changes, as well as the core skills that you see on the slide. So problem solving, decision making, seeking supports, goal setting, and engaging in activities as they relate to managing medications. And as Kiesha talked about, individuals with SCI often experience different challenges when it comes to self-managing medications, but there aren't very many resources that both specifically and comprehensively focus on medication self-management among individuals with SCI. So this led us into the overall aim of this program of work, which was to support the improvement of medication self-management among adults with SCID across Canada. As I very briefly mentioned at the beginning, there was a working group involved in this work. So all aspects of the research were guided by the working group, which was comprised of 9 adults with SCI, 1 caregiver, and 9 healthcare providers from across Canada. Overall, this was a 4-phased study. So first, we set out to identify and prioritize content to include in the toolkit. We then co-designed a prototype of the toolkit, refined and finalized the prototype, and then finally conducted an evaluation of the prototype. And I'll go through the methods that we did for each of these, as well as the results in a little bit more detail. So starting with phase 1, which was identifying and prioritizing the toolkit content, and any of the QR codes that you see throughout here are just linked to the published papers of these phases if you're interested. So to figure out what to include in the toolkit, we conducted a concept mapping study. So if you're not familiar with concept mapping, it's essentially a very collaborative process between the research team and participants, and it's really driven by participants' thoughts, ideas, and perspectives. It consists of 6 key steps, which I will go through in a little bit more detail. So the first step is preparation, and this includes identifying and recruiting participants. So for this phase, we included adults with SCI, caregivers, and healthcare providers from across Canada. The next step is brainstorming. So 30 participants from across those 3 participant groups brainstormed as many ideas as possible in response to the guiding question or focal prompt, which was, if a resource was being developed to help persons with SCI manage their medications, what should it include? So brainstorming sessions were conducted as virtual focus groups, interviews, and independently online using a group wisdom concept mapping software. After a long list of ideas had been generated in response to the focal prompt, the research team engaged in a statement synthesis process, which was essentially done to reduce the number of statements down to a manageable number for the subsequent steps. So the next step was sorting and rating. So 35 participants took part in the sorting and rating phase, and this was done independently online using that group wisdom software. So first, participants sorted the list of statements into conceptual or thematic piles and assigned a name to each pile. They then rated each statement based on how important they thought it would be to include in the toolkit, as well as how realistic they thought it would be. And this was done on a 5-point scale, with 1 being not at all important or realistic, and 5 being extremely important or realistic. The next step was the concept mapping analysis. So we used group wisdom to conduct these analyses, and this was basically just done to create visual outputs and maps of the data, which I will show you in a little bit. We then held a mapping and interpretation session, and this was done with a subset of 10 participants. And the goal of this session was to select a cluster map solution, review all of the statements within each cluster, move statements to the cluster it fit best conceptually, and then finally finalize the labels for each cluster. So this is the result of the mapping and interpretation session, and I will orient you to all of the points and colors on this map. So this is an 8-cluster map, which essentially means you see 8 different shapes and colors on this map. Each of the points or dots with a number corresponds to a statement that was generated in the brainstorming session. The closer the points are on this map, the more likely participants were to have sorted them together, meaning they're more likely to be conceptually similar. So overall, there were 8 clusters or categories of information that participants thought would be important to include in the toolkit. So these clusters included information sharing and communication, healthcare provider interactions and involvement, peer and community connections, supports and services for accessing prescription medications and medication information, information on non-prescription medication and medication supplies, safety and lifestyle considerations, general medication information, and practical information and strategies related to medication taking. So of all of these 8 clusters, participants thought that the safety and lifestyle considerations cluster was the most important and realistic to include in the toolkit. And if we take a closer look at some of the most important and realistic statements that came out of that cluster, we can see 4 of the top 5 most important and realistic statements actually came from the safety and lifestyle considerations cluster. So participants thought that it was important to include information on pain, including management of pain with medications, being aware of what medications are taken and why, information on changing or stopping medications, what to do in case of accidental or emergency situations. And then lastly, this was from the practical information cluster, but information about medications that is easy to understand. So the next step of concept mapping is utilization. So this is essentially how are we going to use that map to create the toolkit. So each cluster or category from the concept map was used to create a module. So essentially each cluster became its own module, and then we also added one background or introductory module. And you can see the number of statements that were contained within the module, which essentially in the toolkit, which I'll show you in a little bit, aligns with subsections or pages within that module. So by the end of this phase, we had the content areas to include in the toolkit. So the next step was actually designing the prototype of the toolkit. So to do this, we did a participatory co-design study, and this was done through 3 main stages. So we set out to better understand and define the problem. We did this by conducting a scoping review to figure out if there was anything we could use to help guide what we wanted to create. We did the concept mapping study that I just spoke about, and then a series of working group sessions. To actually generate the prototype, this was done through 3 working group sessions. And then we did some testing and iterating of the prototype. And this was done through ongoing website development meetings, as well as a working group session. So our goal by the end of this was that we would be able to launch the website. So in terms of a few results, starting with stage 1, so this was the scoping review, concept mapping study, and working group sessions. So we found that there was a lack of published tools that we could use to help guide the development of the toolkit, which is why we ended up conducting the concept mapping study. We then started developing written content that aligned with those statements from the concept map. And we presented these to the working group, and working group members generally felt as though the information was very comprehensive, informative, and easy to understand. We also talked about how to present the content in the toolkit, and working group members felt it was important to present the content as text, videos, infographics, and pictures to cater to different learning styles. We also talked about different accessibility considerations in terms of appropriate color contrast, having a large font size, a clean layout, and limited scrolling. And that leads me into the ideal delivery of the toolkit, which both concept mapping participants and working group members felt was online as a website. So next was stage 2, and this was really actually getting the toolkit together. So we focused on the visual aspects in this phase, where we created infographics, videos, slideshow presentations that we engaged the working group to get their feedback on the overall appearance, the visual messaging, and any recommendations for improvement. Through this, we also finalized fonts for the toolkit. So in terms of main headers and body text, we selected a color scheme for the toolkit, which you can see here on the right-hand side of the slide. And that was integrated throughout all aspects of the content we were creating. And the working group also selected the name for the toolkit as MedManageSCI. So this is just a quick example of how some of the visual content was revised based on the working group sessions. So in the upper left-hand corner, you can see the original scene from a video, and this was about communicating with your healthcare providers about your medications. Right below it, you can see the revised scene, and this incorporated feedback from one working group session. And then finally, on the right-hand side, you can see the final scene from the video that incorporated feedback from all of the working group sessions. So some of the key changes that were made are the healthcare provider is seated at eye level with the individual with SCI. It's made to look a little bit more like an office environment by adding a desk and a door. And then we also added some words to align with what was being said at that time in the video. And then finally, for stage 3, so through the website development meetings, we created the brand identity, design features, accessibility requirements, and the logo, which you can see here. We created the online version of the toolkit, and that was is accessible both on desktop and mobile phones. We updated pictures throughout the website as we engaged with the working group during this stage, just to be more representative of the population, make sure the wheelchairs were modern. And then we also enhanced the navigation. So we added some buttons to the main toolbar to help facilitate that. And we also decided on a mechanism for collecting testimonials and feedback from users, which we added to the Contact Us page. So by the end of this phase, we had a fully functional online toolkit. However, our research team had primarily been responsible for creating the written content in the toolkit. And this was done based on best practices, research, guidelines, and informed by lived experience. However, the written content had actually not yet been reviewed by the targeted end users of the toolkit, which was individuals with SCI. So before the toolkit went live, we did want to get more feedback on the written content to make sure it was understandable, it was clear, it was relevant, and it was delivered in an appropriate way. So to do this, we engaged in qualitative interviews with individuals with SCI, and this was done with 16 individuals across Canada. We conducted cognitive interviews, which essentially meant that we would share our screen with pre-selected modules, and individuals would review the content. And after each section, they would be asked to explain the content in their own words, if there was anything they thought was confusing or they thought might be confusing to others, as well as just general recommendations for improvement. We then organized all of these recommendations into 3 main areas: comprehension, design, and delivery. So starting with comprehension, participants provided a number of recommendations to improve any proofreading errors, simplify the information, revising sentence structure to better emphasize key points. There were also recommendations to enhance the accessibility, both in terms of individuals' ability to access the information and resources, as well as general accessibility considerations. So one recommendation that was provided here was to add alternative text to all of the to all of the infographics and pictures for those who are partially sighted or blind. So that was one thing that we did within that. And then lastly, revamping resources. So the toolkit contains a number of downloadable resources. So these recommendations were to improve any of those resources, and many of them did align with other categories, specifically the design category. So some of the recommendations to improve the design included formatting the content. So we added intros to the different pages. We added subheadings throughout some of the modules to help with flow. We also helped improve streamlining the function. So we added more links to pages that contained relevant information, as well as to external resources. And then lastly, enhancing visuals. So this included all recommendations or revisions to enhance any of the visual components, so the infographics, pictures, or videos contained throughout the website. So this is just a quick example of how one of the infographics in the toolkit was updated based on participant feedback. So this is an infographic that shows different routes of medication administration. And participants flagged that the sublingual or buccal icon was problematic because they couldn't differentiate visually how it differed from oral medication administration. So participants emphasized the importance of the icon clearly showing the tongue lifted in the mouth with the arrow underneath, so they could differentiate visually how oral and sublingual medication administration differed. And then finally, web-based delivery. So participants talked about a number of perceived advantages of a web-based delivery instead of a paper-based toolkit. And some of those included having a wider reach, so being accessible by people across Canada and beyond. It's easier to update, so as new references, resources become available, we can essentially update the website in real time. And then finally, it's easy to reference. So participants talked about how they could pull up the toolkit on their phone if they were in an appointment with their healthcare provider to either share information with them or to help guide conversations. So now I will give you a very quick orientation to the website. So on our homepage, we have some different information about how the toolkit was created and things like that. But if we dive into exploring the toolkit, then if we scroll down, we have the different modules. So there are a total of 9 modules, and each module can be explored in any order. However, we did try to put them in an order that made sense flow-wise. So you have the title of the module, the approximate time it would take to review the module, and then the objective, which essentially just provides a little bit more information or detail about what you can expect to find in that module. And if we click on a module, that will take you into the actual content. And there are 2 ways to navigate within the modules. There's this toolbar on the left-hand side that includes all of those topics or statements, essentially, that you can click through there. You can also, at the bottom of every page, you can go forward or backwards. So if you did want to start at the beginning and go start to finish through the entire toolkit, that allows you to do that. Then we have an about page, and this shows how the toolkit came to be, the vision, mission, and highlights our team. So as I mentioned at the beginning, Sarah was overseeing this program of work, and then myself, Rasha, and Malia engaged with the working group. So I'm just going to quickly highlight all of these members because we would not have been able to create the toolkit without them. So Kiesha, Mike, Anita, Allison, Roberta, Shannon, Phil, Carolyn, Hardeep, Aaron, Tracy, Diane, Holly, Maria, Emily, Oop, and Sveta. And then we also had the broader research team that engaged in different aspects. So this toolkit has really been enhanced with the involvement of this team, so I can't thank them enough. And then we also have a resources page. So all of these resources are embedded within the modules, but if you are just looking for specific resources, that can be done in this page. So If you just wanted to filter by specific types of resources, so for example, you were just interested in watching the videos, you can filter by videos and that will show you just the videos. You can also filter by topics. So we have a few different topics. And if you select a topic, you'll be able to see the resources that align with that topic. And then finally, as I mentioned, we have a contact us page. So we've got some place for if people were interested in asking questions or providing feedback, that can be done here and it's sent to our email. So that's just a very quick overview, of the toolkit. And I didn't mean to stop sharing. So we will continue now with the evaluation of the toolkit. So after we had the toolkit, it had been revised, we were ready to evaluate it. So basically we were looking to see, did people like it? Was it implementable? Is it something that could be used? And did it help improve any of those key aspects related to medication self-management? So we did this through a mixed method study, doing quantitative surveys and follow-up interviews. And this was done with adults with SCI across Canada. So in terms of data collection, this was all done virtually. So it began with a pre-toolkit survey, which collected participants' demographic, clinical, and medication profiles, as well as the effectiveness outcomes. So medication self-efficacy, beliefs about medications, and medication management capacity. Upon completion of this survey, participants were directed to the MedManageSCI website, and they were asked to explore it as much as they wanted to over a 1-week period. After 1 week, they were sent a follow-up interview, which looked to collect information on the implementation outcomes. So was it feasible, was it acceptable, appropriate, and usable? If participants completed the post-toolkit survey, they were invited to take part in a follow-up interview where we further dove into some of those primary outcomes as well as individuals' overall experiences using the toolkit. 3 months later, they were sent a second follow-up survey, which again looked at those secondary outcomes and looked at if people had been using the toolkit over that 3-month period. So just in terms of some of the analysis, I won't go into any depth about this, but the quantitative data was analyzed descriptively. We looked at paired samples over time. We used an iterative process to examine and analyze the qualitative data. And the purpose of the qualitative was really to help explain and expand on what we were seeing in the quantitative results. And then finally, we integrated this data, and I'll talk more about the integrated results. So just in terms of participant numbers, we had 49 participants complete the pre-toolkit survey, 40 complete the 1-week post-toolkit survey. We had 21 interviews conducted with individuals, and we had 38 complete the 3-month survey. And then we did have to remove a few individuals' data, and this is just reflected later on. So in terms of some of the results from the primary outcomes, so the implementation side of things, feasibility was rated highly. There was an average of 4.26 out of a maximum of 5. And participants generally felt the toolkit was easy to use, it was doable, possible, and implementable. And from the qualitative interviews, we heard that the information was practical and the resources could be used right away. So as one participant said, I know I'm going to use it, MedManageSCI. I know I'm going to use quite a few of the downloadables. I think I need to talk to my family doctor about alternatives, and that came out of that, the toolkit. Participants also talked about the accessibility and availability of MedManageSCI in supporting the feasibility. So it's free, it's online, which made it very easily accessible. And then finally, the self-guided nature of it. So participants could focus on content that pertained to them, and they could go at their own pace. Next was the acceptability. So participants thought it was welcoming, they liked it, and it met their approval. Participants talked about the visual appeal and design preferences, so they generally liked the color scheme and the layout. And this was said by a participant who said, like I said before, it's very professionally done. It's weird. I felt welcome there. It was just, I almost got a calming feeling about it. Sort of, maybe it was the color selections. Participants also talked about the balance of written and visual information, that there was a variety of written text, but also supported by infographics, videos, and pictures, which helped to break up some of the larger sections of text. And then lastly, the depth of information and comprehensiveness, that we covered a lot of topics related to medication self-management, but also provided links and references to where participants could, or users could learn more. Next was the appropriateness. So participants generally felt that MedManageSCI was a good match. It was applicable, suitable, and fitting. And what we heard in some of the qualitative interviews was that it was applicable to everyone with SCI, just at different time points throughout their life. And more specifically, for those who are newly injured, those actively going through medication adjustments, as well as those aging with SCI who may be developing new secondary conditions or just overall changes to their health. So as one participant said, I can see how it would be super helpful, especially if you're new to medications, or if your medication has gone from something simple to, a lot of complex things. And then there was a perceived utility despite varying needs. So even if participants didn't think that they needed the toolkit, that they had already figured out their medications and how to manage them, they still spoke positively about it and thought it could be beneficial to others. And lastly, the usability. So this was also rated highly. Participants talked about their likelihood to return to the toolkit. It's a clean and simple presentation. The information was trustworthy and credible, and it was both easy to navigate and easy to use. From the qualitative interviews, we heard that the information was evidence-based, that the toolkit was created from a study conducted by a university, which enhanced its credibility. And it was also grounded in lived experience, with the profiles of people with SCI highlighted on the website. Participants also talked about the ease of use. So it was very easy to navigate the website, to get through all the information in the modules, and future engagement and knowledge sharing. So many participants talked about the toolkit being something they were either planning to use or they knew they could return to in the future if they needed to. Some had also talked about how they had already shared it with other individuals with SCI, with their family members, and with their healthcare providers. And this was mentioned by a participant who said, I deal with, like I said, dozens of people with SCI, and many of them are significantly struggling with the load of medications they're taking, and also trying to figure out, can they reduce them and how? So I'll be referring clients to the website quite a bit. And just to quickly note the secondary outcomes, so we didn't see any statistically significant changes in any of our secondary outcomes, but overall this wasn't too surprising because most of our participants were 5 or more years post-injury and were managing their medications quite well and had really high baseline levels across these measures, which made room for improvement fairly minor and hard to see any differences. So just to summarize, this was a 4-phase study from creating the toolkit to evaluating it with the overall goal of improving medication self-management among adults with SCI. And I will pass it back over to Kiesha.
So these are 2 impact statements made by 2 of our working group members. The first is from Shannon, and she said, "This toolkit is so helpful, and I wish something like this was available upon my discharge. Upon coming home, life can be overwhelming, and having this informative kit reduces a lot of stress. Assisting in the making of this and seeing the final product has been a pleasure, and even I have learned things. This is a gift that keeps on giving, as you may find you refer to it several times throughout the years." And then one from Roberta. "Collaborating on this toolkit with my peers has been such a rewarding experience. Even on those sad days when I feel disabled with nothing to add to the world, I can look back at the process of this building, or from this build, from the very concept, and remember that this is a tangible resource based on our lives. My hope is that the toolkit becomes a mainstay in practitioners' offices, rehab hospitals, and pharmacies, so that every disabled person, newly disabled or seasoned, has information at hand to guide them through the day-to-day management of their meds. Hopefully this tool alleviates having to forge your own path. And I'll echo that and agree with both of those and just add a little more, that this toolkit would have made a huge difference for me when I was newly injured. It probably would have saved me years of trial and error, frustration, and time trying to figure out the right medication routine and which medications I actually needed. Having clear, easy to understand information would have helped me feel more confident, ask better questions, and be more involved in my care much earlier on. I also would have felt more comfortable sharing the resources from the toolkit with my healthcare providers to help support my needs. Because of my experience, I'll definitely be recommending this toolkit to anyone who is newly injured. And then a couple key takeaways. So as you can see, and as Lauren presented and myself have presented, the MedManageSCI is about way more than just remembering to take your medications on time. It's about helping people with spinal cord injuries gain some independence back by giving them the tools to understand and manage their own health, instead of having to rely completely on healthcare providers to choose, organize, and explain, and remember everything for them. With the toolkit, you can really take control, knowing that you're tracking your medications, and managing your routine with confidence. It also brings a huge sense of relief. Having checklists, schedules, and side effect trackers makes everything feel more organized and a lot less chaotic. Instead of constantly stressing about what to take and when, you can spend more time focusing on your recovery and your day-to-day life. One of the hardest parts after a spinal cord injury is understanding why a medication was prescribed, what it actually does, and how it might interact with your other meds. The toolkit helps with that too, giving you a place to learn and really understand your meds. One of the biggest advantages of the digital platform is how convenient it is. You can access everything right from your phone or computer and easily share it with others. There are also options to print the information and checklists so you can bring them to appointments or share them with your doctors, family members, friends, or even caregivers. The toolkit includes both videos and written content, so you can learn in the way that works best for you. And since it's online, you can go through it at your own pace and come back to it whenever you need. All of this helps build confidence in your care. With everything else that comes with living with a SCI, this takes one more thing off your plate and helps you feel reassured that you're making the right decisions for your health. Another thing that makes this toolkit special is that it was designed with input from people who actually live with spinal cord injuries, as Lauren has said throughout this whole presentation. Throughout the entire process, our feedback wasn't just heard. It was taken seriously and used to make real changes. It was an amazing experience to see our voices truly matter. With people of different ages, injury levels, and experiences involved, it was really valuable to hear so many perspectives and see how differently everyone approached things. Because of that, people using this toolkit can trust that the information reflects real life experiences, not just textbook knowledge. It's practical, relevant, and especially helpful for those who are newly injured. This is something that means a lot to me personally, especially as a quadriplegic navigating a world where accessibility is often overlooked, whether it's inaccessible bathrooms or buildings with only stairs, simply because people don't always think to include those of us who rely on accessibility. Looking back, the past 3 years working on this toolkit have been incredible. It doesn't feel like it's been that long, but being part of something where our voices were heard and seeing it all come to life has been such an honor. Knowing that it's going to make life easier for others with spinal cord injury makes it even more meaningful. So thank you for letting us be here and listening to us and our experiences.
Awesome. Thanks, Kiesha. And I'm just going to finish up with some of our plans for what comes next. So as I mentioned, a lot of our participants and throughout the process, we heard from the working group members that this toolkit is probably better early on after somebody's injury when they're ready to access the information. So our plans are to implement and evaluate the toolkit among those who are newly injured, so within the first 5 years post-injury. There's also potential to translate the toolkit into other languages, and this was also something really emphasized by our working group. Unfortunately, which is outside of the scope of what we were able to do within this project, but is something we'd like to do in the future. And then we're also looking to better understand the impacts of multiple medications. So we know it can be challenging to manage, but what does the day-to-day life really look like for somebody who's struggling with their medications? So we have plans to further explore that in future. So with that, I would just like to reiterate a huge thank you to all of the members of the OptiHex Lab who have contributed to this, the Craig H. Nielsen Foundation for funding the overall work, and CHR for supporting me through a doctoral award. And we would like to welcome any questions that anybody might have.
Yeah, thanks so much, Lauren and Kiesha. That was great. Anybody, if you want to raise your hand or speak up, I do see that Craig has a question in the chat that says, Craig, are you there? Do you want to just ask it or?
Yeah, sure. So now the study's completed, and I guess you just alluded to it with your last slide, but what is the one research question you wish you would have asked after having completed the study that you didn't ask?
Yeah, that's a good question. I can speak, and then Kiesha, if you want to add anything, you're more than welcome to. But I'll say the biggest question that we didn't ask that I wish we would have was tracking usage of the toolkit, seeing if people actually completed the toolkit modules, how often they were engaging with them, because I think that could also be a reason that we didn't see any significant improvements in the secondary outcomes if people weren't really engaging with the content that could impact that. So I think that was one key thing that I wish we would have tracked and asked.
I don't know if I have much to add to that. I think that's more of a you question. Even everything being a part of it and within those working session groups, the amount of questions and the amount of openness that we were able to provide, like they didn't ask us black and white questions and they didn't ask us like, you can change this, and this. No, the floor was open and we got to provide as much feedback as we wanted. So they didn't need to ask us questions. We just got to provide it. So in my opinion, we got to, I don't know if there was any more questions that we could have been asked. We had an open floor, if that makes any sense.
Any other questions?
I can't find the hand, so can I just talk?
Yes.
I'm wondering how you're going to get all this information in this website out to the people that need it and want it. Like how will you get it like other than what you've done here, which is good. I'm just wondering how you're gonna get it across Canada.
Yeah, that's a really good question and something we've talked about throughout the process. So we do have some partnerships with different provincial SCI organizations, and we're asking them to promote it, include links on their website, so people would be able to access it through, for example, SCI Ontario or organizations like that. Our working group has also emphasized the importance of having like a one-page document that can be included when people are discharged from either hospital or inpatient rehab that has just a one-page overview of the toolkit, the link, maybe a QR code. So they have the information to be able to access the toolkit if they chose and when they were ready to access that information.
And I'll echo that. And with Lauren emphasizing the readiness, so at the very beginning of my injury, as soon as you're injured, you have too much information coming at you. Like if you were to give me that right at the beginning, I couldn't handle it. It's not something that I would feel comfortable going to or have any knowledge about it. So it's that having that resource and being able to put it away until you're ready to actually go through all those discharge papers and all that stuff. So the readiness, I think, is a huge deal in that it would be amazing because we know 5 years, 10 years down the road, we wish we had it at the beginning. But at the beginning, it's too much. Like you can't. So even if Lauren wanted to go in and give it to everybody that needs it, it wouldn't, some people just aren't ready.
I wrote down a couple of things, but maybe a couple of things were just kind of comments and that sort of thing. Congratulations, like this is a really comprehensive, well-designed study, like with a really practical tool at the end of it. And you guys have done such a great job with that. And then Kiesha, I would echo like the importance of, really having persons with lived experience. This was definitely included so well here. So just, great for all that. I would just ask, like in your future, are you going to be looking at sort of the viewpoint from some of the healthcare providers in terms of how this tool might be received in the office, in the pharmacy, by people who prescribe or distribute medications and that sort of thing? And then the other question or comment is, did you have any people with other disabilities happen to kind of use this informally? I know this is spinal cord injury and disease, but it definitely would have applicability to a number of other, similar conditions, MS, etc. Did you happen to have you heard from any people who've used it in that regard, or do you have any plans of, that would be a bigger thing, but just those comments, I guess.
Yeah, so I can start and then welcome Kiesha or even Sarah to chime in if you'd like. So we do have plans we're seeking more funding now, as I mentioned very briefly, to implement in individuals who are newly injured. But part of that is we do want to engage with providers, people in the community to better understand the implementation process and what supports they might need to help with the actual implementation and dissemination of the toolkit. So that is a plan for upcoming work. And then I do like how you brought up the other populations piece, because that has come up a lot in the working group conversations, as well as discussions with our research team. But a lot of the content in this toolkit is applicable beyond spinal cord injury. So even though it was developed with people with spinal cord injury, for people with spinal cord injury, there's a lot of information that's applicable to anybody who takes medication. So I think in terms of some future work, it could be expanded to other populations by engaging with them. What content in here is relevant to you? Is there anything that might be different or that we would need to add or supplement? So definitely a lot of possibilities and potential for future application to other individuals.
And I think the only thing that I'll add, and then we can pass it to Sarah, is we did talk about in the working groups how we approach bringing it into the doctor's offices and stuff. And there was a lot of talk of like a brochure, or again, like Lauren was saying, like a piece of paper that maybe the doctor's office could have and be able to hand it out to people that they think would it be relevant. But that was definitely in the talks. I just don't think that it's been implemented.
I can't see everybody here, so I'm not too sure if there's other questions. You might be able to see there, Katie.
That was one thing I was just going to ask. What results surprised you the most?
I can start with that. I'll be very honest with my response here is the impact. I think, as researchers, we often think, and we know the potential impact our work can have, but I think you don't often see that play out. And through this project, we've actually been able to see that play out. And as Kiesha spoke to some of the quotes we have from people, but this toolkit is impacting people in a very positive way. And yes, I knew the potential it could have. I didn't anticipate actually like being able to see and hear that from people. So I think that was probably the most surprising from my end.
I'd say from my end, mine's kind of minor. I don't see the research side of it and everything, but being able to be in that working group, it was a pretty small group, but there was about 7 of us. But with all the different age groups, with all the different perspectives and spinal cord injuries, like when we had them and everything, it was really cool to see everybody else's perspective on each individual. So for example, we took the information and the slide that Lauren was talking about for them to pick out certain things and be like, oh, I think this would work better for like somebody else that like has trouble seeing certain colors, or like being able to interpret different things. That was really cool to see, like wouldn't have even thought of that. And it's such a huge thing in somebody else's life that would make such a big difference. So seeing all the changes that were made and implemented based on different perspectives.
Okay, any further questions? Okay, otherwise, again, I want to thank you so much for the presentation. I would love to get some kind of one-pager from you guys so that we could put it up in our clinic to advertise it. So that would be wonderful. I think Katie is going to put our QR code done for up for the survey if people wouldn't mind doing that before you leave. And again, thank you so much for the presentation and for everybody's time in coming out. Hang on while that QR code comes up, scan that, do that before you leave. Thanks, everybody.